Hi everybody, we're here with Cam Fary, a specialist hip surgeon who's going to take us through a condition that's being observed a bit more frequently these days called FAI. So what is FAI, Cam?
Thanks, Cory. Well, the hip joint, let's talk about it. So the hip joint is a fantastic joint. It's a ball in a socket. So mechanically, it just needs to be a round ball moving in a socket. FAI is the short for femoro, meaning femur, acetabular impingement. What that means is that the ball is not perfectly round, or the socket is even maybe too deep. Now, these patients commonly present to people like Cory, and so I'm just going to ask him, what sort of patients do you see that present with FAI?
So it's commonly people that come in with pain at the front of the hip area, often associated with sitting in chairs in low positions, having trouble getting to their shoes and socks, those sorts of rolling in bed at night when the hip joint, those bones are jamming together, and that causes that irritation in the hip joint just because there's a lack of space there, and that's the thing that sets off the symptoms.
So what Cory was talking about there is exactly as he said, is that the bump sits here at the front, most commonly a femoral bump. It hits the soft tissue and the bone and causes the pain. So the mainstay or the first line of treatment is people like Cory, who sees people with these problems and then works out ways of dealing with it. There's a simple way of thinking of it, what I explain to patients. It's like this bump is in the way. It's like having a low door frame. You can either duck your head walking under the door each time so it doesn't hurt, or you can walk in, hit the door on your head each time and it hurts. So that's your options essentially with physiotherapy.
So there's certainly some things that we can do in terms of improving the control of your gluteal muscles, releasing the tension in some of those tissues around the front of the hip joint that are irritable, and assisting with settling down that inflammation. But if things don't settle down, then Cam is the right sort of person to see, and he has some other interventions which may be helpful.
Yes, so basically if you can't stop the bump from hitting the area, well then we have to then remove it. And so that's when we talk about arthroscopy or minimally invasive surgery to remove it. There's lots of other things involved with that as well, because there's often damage to the hip joint, and that's when people get progressive problems and when physiotherapy doesn't tend to work.
So if you're recognising these symptoms in yourself or somebody else in the family is having pain at the front of the hip and is reporting those sorts of symptoms in those positions we talked about earlier, then feel free to come in and see us, and we'll assess you and see if it's an issue that we can help you with, and hopefully you won't have to go and see this guy down the track.